Let's take a look at a few highlights of the OurHealthConnector medical record. You can see that the record is well organized and readable. This patient has received care from many places over the years. Providers have worked in different organizations all over the country and, in fact, all over the world, using different technologies to collect and store the data. Our team at OurHealthConnector collects this data and pulls it all together into this complete record on behalf of the patient. If this record's owned by the patient, how do we know the information is accurate? Well, every finding in this record came from somewhere. To verify for yourself that the information is accurate, just click on the original source document, and you'll see the complete report from which this finding was derived. Now, the findings can be attached to reports like this, but they can be so much more. Let's take a look at a cardiac ultrasound, for example. Not only will you get the analysis, but you can actually see the original source data. This is true of an ultrasound or X-ray or MRI. Now, the real key to making sure that a record is accurate is to have everybody looking at the same information. So when you're looking at the record and you have a question or comment or concern about the record, you can simply go to the finding, add a message or a comment or a concern. Please check on allergic reaction in 1990. Some kind of a comment. And all of the communication between doctors and caregivers, guardians and caseworkers are all done in the context of a complete record. Today, errors in a medical record are usually not discovered, and they are rarely corrected. Another way to accurately view the information is to take a look at it from different points of view. By system, by problem. Look at a problem-oriented view, and you'll see that all the information, subjective, objective, diagnoses, plans, family history, are all swept together in the context of a current patient problem. Now, where does the best information come from? Well, it comes from the patient. And we use the world's most sophisticated patient interviewing tool to create this kind of a quality report. It's been proven to be far superior to handwritten notes collected during a brief office visit. Well, how do we make this record usable by the physician? Well, we've worked hard to keep it very clean and organized, but we also remove the clutter by putting all of the similar findings together so that in one line you can have access to the individual findings. Here, a simple example, the patient's been weighed, and you can see the date of each finding, and we tell you how long ago it was and how old the patient was, and a chart which reveals trends that happen over days, weeks, or even decades. What if your doctor wants to get a copy of this report? Well, that's our job to provide it to them, whether it's in a beautifully formatted paper form or whether it's in an electronic form. Our job is to give it to your caregivers in a way that does not disrupt their workflow. We are not replacing the medical record system used by your doctor. We are simply giving them, for the very first time, a complete and accurate record to work with. Now, some people think this process may be too expensive. Well, it's not theory. We're doing this. We're managing the records of patients with complex medical problems who have received care from around the world. The cost of not having a complete record is much greater than the cost of creating it. So without this record, you'll see that tests are repeated, errors are made, communication between the patient and doctor is very inefficient. So if it takes a lot of effort to create a complete record, let me ask, do you want to do this process once, or would you like to do it each time you see a new caregiver? The real question is, can you afford to not do something like this?